and good morning to all the viewers. I decided to use my platform as a medical doctor to discuss mental health issues after I had experienced a public relapse and realized that there's still a very little level of understanding related to mental health issues. So I decided to, instead of hiding in the space of shame and self-doubt and self-discrimination, and self-stigma, I decided to use my platform and discuss my struggles. It definitely wasn't something I planned to do, but it's something I feel was a responsibility for me.
What responses did you get from the medical fraternity, especially your close colleagues?
It's been a mixed reaction. Largely, it's been a positive one. It was a very scary stance, scary decision to take because not everybody is embracing, and you can get seen differently and doubted professionally. And I definitely did get stigmatized in that regard, where my professional abilities were doubted. And I was even reported at a medical body to be investigated regarding my wellness and capabilities. But I've taken it in my stride and decided that I will not be argumentative about it. I'll just let the authenticity of my message take priority.
So now the biggest focus in relation to mental health has moved to coping with the effects of COVID-19. How has this impacted your strategy? Are you finding you're having to bring that in as well?
Absolutely. I've been very mindful in how I carry myself in terms of setting boundaries professionally, in the sense that I safeguard myself and protect my mental health and am more intentional about it. And I believe that speaking about our struggles is very important in order to not feel isolated and feel that you are in a space of self-doubt. So I have integrated in the sense that I'm open about my challenges and to not play a superhero when it is a very difficult space to be in.
Just take us through some of your experiences, both personal and also with your patients, in terms of the difficulties of coping with COVID-19.
The difficulties is that one carries this anxiety often in coming to work. You never know if you'll end up being diagnosed. One is always being exposed on a daily basis. And as frontline workers, you can't get to a point where you say you are stepping away from the work environment, which is why it's so important to realize that we are not exempt from having this disease. And our patients as well feel constantly anxious about contacting the illness, and the changes in the lifestyles has been quite significant as a result.
Give us a sense of what your patients are saying to you about taking vaccines, because today we're focusing on vaccine hesitancy. What sort of conversations have you been able to have with your patients?
There's still a strong level of hesitancy. Patients with background comorbidities, who have underlying medical conditions, are the ones I find who often ask about the fact that is it safe for them to take the vaccine if they've recently had, a dip in their wellness, their physical well-being. They become reluctant to come forward and have a vaccine. But I believe that educating people and explaining what side effects to expect, which possible ones, I think it's very important to validate the experiences of patients and allow them to ask the questions so that they understand the benefits of taking the vaccine.
We thank you very much for your time. And just a quick one, what sort of hacks or responses are you giving to your patients in terms of how they can deal with this mentally?
I think it's very important to be informed at all times, but in that, to have space for yourself, to have boundaries in terms of how exposed you are, and to test the information that you receive, and to also give yourself time to self-care and provide yourself with that space to look after your well-being as well. To not constantly be fed constantly by social media all the time, just to unplug at times and give yourself that time to preserve yourself mentally, despite the responsibilities that still pull us in all directions, basically.
Yes, thank you very much for your time, Dr. Samke Ngcobo, talking to us there about the challenges of mental health as the nation continues to fight COVID-19. Now, today's Africa